In this video, we're going to go over the 5 best supplements that you could be taking for joint pain from osteoarthritis. Hello, I'm Dr. Grant Cooper from Princeton Spine Joint Center. Before we get into the 5 best supplements to take for joint pain from osteoarthritis, let me make one quick point. I don't sell supplements. I haven't been paid to make this video. I'm a doctor who's obsessively interested in health, and I take care of lots of patients with joint pain, so I want to know everything there is to know about supplements and anything else that can help out my patients. Now, 2 important disclaimers to put out there. First, always talk to your doctor before starting any new supplement. It's just a good idea to do this. Supplements can interact with your medications, and just as supplements can have positive effects, they can have negative effects on your body as well. So please talk to your doctor to make sure that taking any given supplement is right for you. And second, you need to know there's no magic pill out there. If someone promises you a magic pill or a pill that will instantly fix all of your joint pain, or any pain for that matter, just shake your head and move on. It's not real. Believe me, if that pill becomes real at some point, I'll buy stock in it and then I'll let you know all about it. Probably in that order. But for now, unfortunately, it just doesn't exist. And with that said, there are supplements that both make sense to deal with the inflammation of joint pain, and also supplements that have survived some rigorous studies to show their efficacy. Okay, are you ready? Let's count down the 5 best supplements to take for joint pain, starting at number 5. The 5th best supplement for joint pain from osteoarthritis is a supplement called Avocado Soybean Unsaponifiables, or ASU. ASU are natural vegetable extracts from avocado and soybean oils that have been found to decrease inflammatory cells, as well as decrease the presence of proteins that play a role in the destruction of cartilage, which is the hallmark of osteoarthritis. Clinically, ASU has been shown to not only decrease the symptoms of osteoarthritis in the joints, and it's important to point out that ASU seems to decrease the symptoms of osteoarthritis in the joints about as well as over-the-counter non-steroidal anti-inflammatory drugs like diclofenac, ibuprofen, and naproxen. But ASU has also been shown to reduce the progression of osteoarthritis. For example, one 3-year study published in 2014 revealed that patients who took ASU had slightly less loss of their joint space in their hips compared with those who did not take ASU at all. All of this has landed ASU at the 5th best supplement for joint pain from osteoarthritis. There are lots of supplements competing for this honor, so congratulations to ASU on this landmark achievement. A typical recommended dosage for ASU would be to take 300 milligrams daily. Again, please talk to your doctor before starting any new supplement. The 4th best supplement for joint pain from osteoarthritis is Boswellia serrata, also known as Indian frankincense. Boswellia serrata is a resin herbal extract from the Boswellia tree that's native to India, Africa, and the Arabian Peninsula. It's been used in traditional medicine for thousands of years, most notably in Ayurvedic medicine. Boswellia appears to prevent the formation of leukotrienes in the body, and leukotrienes are a significant part of the body's inflammatory response. Boswellia has other potential health benefits as well, including improving symptoms in asthma, helping to treat autoimmune disorders such as rheumatoid arthritis, as well as helping to treat inflammatory bowel diseases such as Crohn's disease and ulcerative colitis. Boswellia may even help fight advanced breast cancer cells, and it may be helpful in fighting other forms of cancer as well. Boswellia has been found to increase mobility and decrease pain in patients with painful knee osteoarthritis. It's because of these demonstrated benefits in treating arthritic pain and debility, coupled with its impressive anti-inflammatory effects as well as the other potential health benefits, that Boswellia serrata has landed as the 4th best supplement to take for joint pain from osteoarthritis. Now, dosages may vary, but the Arthritis Foundation suggests taking 300 to 400 milligrams 3 times a day of a product that contains 60% boswellic acids. Now, that seems like a reasonable dosage. Of course, again, talk to your doctor before starting any new supplement. The 3rd best supplement for joint pain from osteoarthritis is actually a 2-for-1 situation. Since these 2 supplements are so often taken together, and since the research consistently suggests that they work better when taken together, I'm including them both here as a 2 for the price of 1 recommendation. The third best supplement are actually 2 supplements, glucosamine and chondroitin. Glucosamine and chondroitin are very popular supplements taken for osteoarthritis. Now, glucosamine and chondroitin have anti-inflammatory effects, and they also protect chondrocytes, which are the cells that help maintain the all-important cartilage in your joints. The story of glucosamine and chondroitin is actually a fascinating one, and it's worth letting me tell you a little bit about it because it shows why you need to be skeptical of early research on new products, especially when that research is funded by the manufacturer or by anyone who stands to earn money if a particular outcome for that product is found. The story of glucosamine and chondroitin also underscores how it's important to not lose faith in a product or item just because it turns out that it may not work quite as well as originally advertised. If it works somewhat, then it works somewhat, and it doesn't matter if in the beginning people thought it would be amazing. Okay, so here's the story of glucosamine and chondroitin. Here's the abbreviated version. Early research was extremely supportive of the use of glucosamine and chondroitin for hip and knee osteoarthritis. In fact, the research was so supportive that usage of these supplements exploded in the United States and across the Western world. If you'd read a book that I wrote on arthritis that was published in 2008, you would have read a glowing review of glucosamine and chondroitin because I was basing it off of all that early research. A skeptic looking back with the benefit of hindsight would point out that the early research was funded by the makers of glucosamine and chondroitin, which is actually a prescription medication in many European countries. Take that funding information for what you will, but the fact is that the follow-up research that was done by independent organizations and by independent investigators, including a large independent study done by the NIH, revealed results that were much more mixed. As a result of these mixed results, a lot of people and doctors fell off the glucosamine and chondroitin bandwagon completely. They just lost faith in them altogether. But mixed results doesn't mean negative or no results, and some of the results are still impressive and they're still worth focusing on. Studies show that glucosamine and chondroitin work about as well as Celebrex, which is a strong non-steroidal anti-inflammatory drug for pain and debility from knee osteoarthritis. And on top of that, glucosamine and chondroitin also have shown some reduction in joint space narrowing. Again, these results aren't nearly as rosy as the initial studies coming out of the pharmaceutical-funded studies, but they're still quite positive, and they're what helped propel glucosamine and chondroitin to the very impressive third place spot for best supplements for joint pain from osteoarthritis. Typical dosages are 500 milligrams 3 times per day of glucosamine and 800 to 1200 milligrams per day of chondroitin. Now, as with any other supplement, please talk with your doctor before starting these supplements or any supplements for that matter. The second best supplement for joint pain is omega-3 fatty acids. Omega-3 fatty acids are essentially the healthy fats in your body. They're thought to do all manner of good things, including improving bone and joint health, improving sleep, improving eye health, reducing depression, reducing anxiety, reducing heart disease, reducing symptoms of ADHD in children, reducing asthma in children, improving sleeping, improving blood sugar, improving skin health, reducing belly fat, reducing overall inflammation, improving nerve health, reducing pain, including reducing pain from menstrual cramps and from migraines, helping autoimmune diseases, possibly improving symptoms from schizophrenia and bipolar disorder, and maybe even preventing age-related mental decline such as Alzheimer's disease. Some studies have also suggested that omega-3 fatty acids might prevent certain cancers. That is a lot of potential health benefits. Some studies have shown that omega-3 fatty acids reduce pain and debility in joint arthritis about as well as non-steroidal anti-inflammatory drugs. It is because omega-3 fatty acid supplementation appears to reduce the pain and inflammation in many patients about as well as NSAIDs like Advil or Relieve, and also because of the overall general positive health effects of low-dose omega-3 fatty acid supplementation, that omega-3s have landed at the coveted second best supplement slot for joint pain from osteoarthritis. If the only metric were joint pain, then I would say that omega-3 fatty acids would still be in the top 6, but might have landed just a little bit lower on the list. But of course, you have to remember that something you put into your body will affect your entire body, and so for omega-3s, it's worth considering that omega-3 fatty acids have a potential for such a wide range of health benefits. One way to increase your omega-3 intake is with a healthy diet. Small, cold water fish such as cod, salmon, sardines, they're a great source of omega-3 fatty acids with relatively smaller amounts of mercury. Nuts and seeds such as flax seeds, chia seeds, walnuts are also great sources of omega-3 fatty acids. Now, supplementation is another great way, of course, to increase your omega-3 intake. Dosages vary, but about 1 to 3 grams a day, depending on how much you're getting through your diet, is about right for most people. Now, as generally healthy as I think omega-3 fatty acid supplements are for many people, and I personally take them, it's important to note that there are definitely potential downsides such as bleeding that can occur with them. Now, also, taking over a gram per day has been associated with an increased risk of atrial fibrillation, so you have to be prudent about taking this supplement just like any other supplement. So again, please talk to your doctor before starting any new supplement, including before starting omega-3s. And now, the number one supplement to take for joint pain from osteoarthritis is curcumin. Curcumin is a true superhero supplement for lots of reasons, and it's the best supplement for joint pain from osteoarthritis. Curcumin is a biologically active polyphenolic compound that's found in the very popular Asian spice turmeric. Turmeric's been used as a therapy in Ayurvedic and other medicinal practices for literally thousands of years, about 4,500 years in fact. Curcumin is thought to potentially help with heart disease, cancer, diabetes, neurodegenerative disorders such as Alzheimer's disease, autoimmune conditions, osteoarthritis, neuropathies, anxiety, depression. And one 2010 study even postulated that because of its inhibition of NF-kappa B and the mTOR signaling pathway, curcumin might be able to slow down the aging process itself. Now, when talking about joint pain from osteoarthritis, curcumin is shown in studies to work even better than non-steroidal anti-inflammatory medications for the treatment of pain and debility. Does curcumin actually work better than medications such as Advil and Aleve? I'm not sure I'd bet my house on that for most people, given that that finding actually only came out of one study. But the overall findings from multiple studies of curcumin for joint pain from osteoarthritis is that curcumin appears to work as well as non-steroidal anti-inflammatory drugs like Advil to reduce pain, reduce swelling and inflammation, and improve function. And importantly, if it works as well as Advil, Aleve, and other NSAIDs, then you would think it'd be a no-brainer to consider taking it instead of the NSAIDs because NSAIDs have tons of potential problems and complications. Consider that NSAIDs account for about 100,000 hospitalizations per year in the US alone just for their gastrointestinal complications. NSAIDs also increase the risk of heart attack, stroke, kidney problems. So NSAIDs, particularly chronic usage of NSAIDs, while still relatively safe, are not without real potential serious medical complications. Curcumin, by contrast, is not just a lot safer, but it carries an astounding array of potential additional health benefits. It's for all of these reasons that curcumin is the proud owner of the title Best Supplement for Joint Pain from Osteoarthritis as determined by me. Now, does that count as an official award? Can we get an award for curcumin for the best supplement for joint pain from osteoarthritis? We'll work on that. While curcumin is found in turmeric, it's not present in particularly high dosages in turmeric. In fact, it's just around 3% by weight of the turmeric. So it's very hard to eat enough turmeric to get the concentrations of curcumin that's been studied in clinical trials. Now, with that said, there's absolutely nothing wrong with increasing turmeric in your diet, and turmeric may have, in fact, other health benefits outside of just the curcumin. Not to mention, of course, turmeric can be very tasty on some dishes. Curcumin supplements should include piperine in the supplement. Piperine is an alkaloid present in black pepper, and importantly for our purposes here, piperine increases the absorption of curcumin by 2,000%. Supplements often list this as biopurine, which is a regulated black pepper extract containing 95% piperine. Now, what dosage of curcumin should you be taking? Studies typically involve patients taking between 500 milligrams and 2 grams of curcumin a day. As always, talk to your doctor before starting this or any new supplement. This is a supplement that I take as well, so obviously I'm a fan, but you have to look at all the other medications you're taking and make sure there's no interactions, and also look at your whole health profile to decide if this is a good supplement for you to take. So again, and for the last time in this video, please talk to your doctor before starting any new supplement. I hope you found this video useful. If you've enjoyed it, if you've learned something from it, please remember to like this video, share it with a friend, and please consider subscribing to our channel. Also, if you've used any of these supplements, or if you've used other supplements for joint pain, please let us know your experiences in the comments section. I would love to hear about them. And as always, if you have topics that you would like for me to cover in a future video, or if you have any other comments, then please leave a comment or a suggestion in the comments section. I wish you the best of health. Thank you very much.